Yes, please.
So we want to finish up the day with looking at a few more things. And then we spend the better part of tomorrow doing the write-up. So when we're saying a research statement or research problem statement,
is actually when we are trying to define what a problem is, I learned that in research, a problem is a circumstance where a solution ought to be thought of and an intervention done. Then when I compare it with the normal setting of our day-to-day activities, we conduct activities, we make reports, and then at the end we have challenges, we have recommendations, we have achievements, and so on. Then in most cases, I have ever heard that where there is a problem, a solution is not easily available. But where there is a challenge can be modified, can be intervened, and then an achievement can later on be derived out of it also. Now, what my confusion now is, or my misunderstanding is, how does that definition of a problem in the normal day-to-day setting be compared with a problem in research? Because as if it is contradicting. Because in the normal setting, they say if it is a problem, then an immediate intervention may not be got. But now in research is a problem, there is a solution to it. Now I'm failing to understand between those two circumstances under which I can define what a problem is or what maybe a challenge is in terms of research.
you have provided the best description actually.
Okay.
When we say a challenge, it is
yes.
Something that is tasking. Okay, you're traveling on the road, and then your motorbike gets a flat tire. Is that a problem or a challenge?
I would say it is a challenge.
That's a challenge. So, but when you're traveling on the road with your motorbike, and then you stop somewhere to susu and they steal the motorbike, is that a challenge or a problem?
That is a problem.
That's a problem. So something that is within your control. Okay, this is my opinion. It is not a research-based opinion. When something is taxing and it is within your control, then to me, I term it as a challenge. Like in a hospital, you have issues within the control of the workers in the facility. Those are challenges. That's why when you're writing reports, we will say achievements and challenges. We don't say achievements and problems. There are ups and downs that we find on our daily lives or in the conduct of our activities. Now, when something goes beyond a challenge, then it becomes a problem. In the case of the flat tire, you call a mechanic and you repair it. You go. You may find maybe there was just a thorn that punched the tire. But when the bike is stolen, you're asking, why did no? They will be asking you. You are going to write a report on how the bicycle was stolen, whatever. Mm-hmm. So, when it comes to the world of research, we go back to our definitions to our criteria. If I can flash back these slides. So, if you're asking whether you need to research on these things, if there is a discrepancy between the desired and the observed, and we know why the discrepancy is existing, then that discrepancy is a challenge. Or there is a discrepancy between what is desired and what is observed. And we also know the best solution. Then that discrepancy is a challenge because it will not call for further research. However, if there is a discrepancy and you don't know why this discrepancy is existing, and two or more potential solutions exist for that discrepancy, and you don't know the best, then it becomes what? A problem. So I can say that challenges are smaller problems that can be managed by common sense. There are smaller problems that can be corrected by common sense, by experience, by expertise. A problem has happened in a hospital, something has happened in the hospital. And then you call the in charge, please, we have something here in the world, please, could you come and help us? Then it comes to solve. That is just a challenge. So as long as you're able to say, okay, this thing just needs money. And there's this problem, that what I only need is just money. You have your wife is disturbing you, that the problem is that you're broke. Just know that if I get money, I just give her the problem solved. So anything that can be corrected through experience, competence, skills, attitude, whatever, by us, and it does not necessitate collecting data. It is just a challenge and it's not a researchable problem. I hope you're a little bit clearer now.
Yes, sir.
So this is where I want us to start from, defining a problem. So we want to begin to identify a problem. And when we identify this problem, we have to state clearly, provide a description of the nature of that problem. For example, you can say that the quality of care of patients with rheumatoid arthritis has reduced. If in the community, if we're talking about malaria, which we know, all of us know, we can say that in this community, the prevalence of malaria has increased. So the increase is the nature of the problem. Or we can say that the number of patients or mothers attending for antenatal care has reduced. So the reduction is the nature of the problem. Because reducing from what? Reducing from what we know. What is the ideal? So we provide the nature of the problem. It can either be services have become poor or inadequate or whatever. So we provide the description of provide the context of the problem. It can be a medical problem, socioeconomic problem, the cultural problem, whatever. After that, we tell the world that the description of the size, distribution, and severity of the problem. This problem is widespread throughout the community, and the magnitude is 20%, and it is severe among children. So who is affected? You can say the children are affected mostly. Even the health workers are affected. There is now increased workload, you know. And then you add the consequences of this problem. So what are the main issues of concern that need to be? So we put in the major factors that we think are influencing the problem. So this has been contributed by such and such factors. Perhaps those that need to be studied. Then the existing gaps in the knowledge that need to be investigated. So we also provide a convincing argument that available knowledge is insufficient to fill the gaps. So what are the main interventions or items that have been put in place? I'm going to shift the slides a little bit. I'm going to shift number 4 to number 3. So we first provide the interventions, and then we provide the main issues of concern. So whenever there's a problem, it is not only you who knows that there's a problem. Minister of Health is aware, government is aware, local government is aware, the local leaders are aware, NGOs are aware about the problem, and they are trying to do something. There are always no virgin problems. They are always trying to do something to make sure that the problem is what? Is solved. And so we want to know, given that they have done something, what is it that is remaining that they have not done? So that is the remaining gap. What is it that is remaining that has not been done despite the interventions? What is it that is remaining unsolved? And that's where now the research begins from. Because the purpose of the research is to fill the gap, and the gap is that problem that is still persisting. And so we want now to conduct research to fill that gap. Okay, so this is an example of a health statement. We want to include all these questions. We have to include the what, how much, who, when, where. So for the what we describe, either the disease, the nature of the problem actually. Then we provide the magnitude, that's the how much, people who are affected, that's the population at risk, in terms of age, race, occupation. We also provide the when, the time of occurrence. Is it a seasonal disease? You know, malaria during dry season is a little bit lower, and then it increases during the dry season. And then we have geographic locations. Now, where is it the problem concentrated? So, whereas these words are many, we just need a simple statement like this one. So we are saying that the instance of measles in mine workers in Uganda, Eastern region, has increased from 200 per 100,000 in 2013 to 400 per 100,000 in 2015. So such a simple statement is actually covering many things. It is covering the what, it is covering the who. The what is the increase in the measles. The who are the mine workers. The where, Eastern Uganda. When, 2013 to 2015. How much? From 200 to 400. So the entire, that is a health statement. Now that it describes the nature of our problem. So that's the nature of our problem, including the magnitude. Then we now go and add other things. You see, this what is driving this problem. What are the challenges? What interventions have been put in place, and the likes. Okay, are we together? Can I get off this slide? So let us try to formulate an example of a problem using these 5 questions. Let me stop the sharing of this. Derek, first give me the host's rights, the rights to share my screen. I haven't shared the other one. First go to the settings and give me the right to. Okay, thank you. So let us assume now that you're a student. You have identified you want to conduct your research in a community. There's an issue with let's say with malaria. As a clinical officer, as a nurse, you have realized that there's a problem in this community and we need to write a problem statement. So there are those 5 elements of a problem statement. So I'm going to do this and then I say description. So we describe now. So the first question here is, what is the problem? So we're going to use an example of malaria, and then we say that there's been an increase in the incidence of malaria among children below 5 years in Kono district. Let me use the word prevalence. Maybe from 9% in January to 20%. Somebody is talking in March 2020. Are you talking or? So we won't go to the next question.
I forgot your mic on.
So what's the magnitude of the problem? How big is this problem? So I think I would have stopped here. As the nature of the problem. So we're saying that there's been an increase in the prevalence of malaria among children below 5 years in Kono district. That's the nature of my problem. So if I'm coming now to the next step, I'm providing the magnitude of the problem. That the prevalence has increased.
By 20%.
By 20%. From 9% in January to this and that. So we got the next question. What are the consequences of this problem? And who is affected? So you can say the increase let's say has resulted into more death, drug stockouts, more death of children. That's the problem. Drug stockouts in the hospital. Work overload for patients, for nurses. Loss of revenue. We call it catastrophic expenditure. The parents. Maybe school dropouts. So there can be so many problems. So we got the next question. What are the consequences? Of the stated problem. Sorry, what has been done? I'm repeating. You're not alert, you guys. So what has been done? To solve the problem. Then we can say MOH has distributed nets. Maybe community sensitization. What other things?
Can we say there is management of cases in the facilities? Hello.
So despite the interventions, what is the remaining gap? We know that they have done the sensitization, they have done this and that. What is the remaining gap? I'm saying maybe more cases are still being reported. Maybe the effectiveness of the interventions is unknown. Also say maybe the factors influencing the prevalence have not been studied. We can also maybe the knowledge on prevention. On prevention. Among community members. No. So those could be the gaps, very many of them. So now, we now go to, because now after identifying these gaps, there can be so many gaps from one problem. And we do not know, we cannot study all these gaps. So now we provide what is what we want to study and what's the rationale. So we shall say that we want to study.
No, that's the point. Let me show the right line. Push him. You should have done
We want to study when what do we want to study? Maybe we can say that since the current prevalence in maybe we want to do this study in one area in Mkono.
Then,
We want to conduct this study in Mkono, but not the entire Mkono. Maybe in Mkono municipality. You can say that maybe there is a need to establish the current prevalence.
Cautious, you forgot your mic on.
Current prevalence in Mkono, and to assess the drivers of the prevalence. Assess the factors contributing to the prevalence. So as to inform the current interventions. Maybe to inform the district administration. And implementing partners. Focus prevention methods. To focus prevention strategies.